Hello professionals and future professionals, I welcome you to another very exciting video. So let's take some few questions from our question bank. Question number 1. Immunoglobulin involved in allergic reaction is A. IgE, B. IgG, C. IgM, and D. IgF. What's your answer? If you choose A as your answer, I'll show you are absolutely correct. So IgE, that's immunoglobulin E, is a type of antibody that fights against allergies. It tends to bind with immune cells, which then tends to release what we know as the hormone histamine, which helps to fight against allergies. So then IgG, that's immunoglobulin G, is a antibody that is found in the blood, which helps to fight up against infection. Then also IgM is tends to fight against also infection, but temporarily. So it defends the body, antibodies that defend the body temporarily. So this is IgM. Then IgF, that's irrelevant. There's nothing like IgF. There's nothing like immunoglobulin F. So we only have 5 types of antibodies: IgE, IgG, IgM, IgA, and IgD. Next question. Now for question number 2. One of the following is not an emergency management of bee sting. A. Is it to refer if allergic reaction develops? B. Scrape off sting carefully with fingernails or blunt knife. C. Wash the area with soap and water. And B. Squeeze the sting. What's your answer? So based on all these options, which of them is not an emergency management of bee sting? Very well, if you chose D as your answer, you are absolutely correct. The option that does not involve, that is not an emergency management of bee sting, is D, squeeze the sting, because when you do squeeze the sting, there's a high possibility of this venom from the bee to grow into the bloodstream, which we do not want. So the emergency management is either you refer if allergic reaction develops, you scrape off this thing carefully with finger, because scraping it off tends to not allow the venom to go into the bloodstream. So that's why you tend to use a blood knife also, or your fingernails. Then you, after removing the venom or scraping the venom out, then you tend to wash the area with soap and water, so that the infection will not set in. So then for the last question. Now for the last question. It's kind of tricky but also simple, and different school of thought tend to give different answers. So but what is your answer? And I would like to know what's your reason for choosing this as your answer. So the question: which body area will provide the best result of assessment of sinuses in a black skin client? A. Back of the hands. B. Earlobe. C. Palm of the hands. And D. Sacrum. What's your answer? Do want to tell me your answer in the comments. Also, as a hint, sinus is this the bluish discoloration of the skin due to lack of oxygen in the blood, enough oxygen in the blood. So this is what we know as sinuses. So which is your answer? In a black patient, which part of the body will you use to detect or assess the presence of sinuses? See you soon.